皆さんこんにちは。北海道大学医学部医学科の宗方です。前回の動画に引き続き OET スピーキングの練習第4弾としてこの動画を投稿させていただいています。今現在イギリスで看護師をしていらっしゃいますロッシュ真由美さんと、現地のスタッフのご指導のもと今回のスピーキングの練習を行っています。それで今回のケースなんですが、今回は路上にて混乱して少し怒り気味になっているところを警察に発見され救急に運ばれてきた患者さんです。それでこの患者さん少し手記を帯びていまして、さらに付き添いの家族のお話によると2年前に仕事を失って離婚して以来鬱になってずっとお酒を飲んでばかりいるといったような状態になっています。それで問われているタスクとしては2つあって、1つ目がこの患者さんへのアプローチ法を考えてその中身を患者さんに説明するといったことと、あともう1つ、患者さんの精神的ケアをするといった2つのことが問われていました。それで今までの練習の中で正直今回が一番難しかったなと僕自身は思っていまして、というのも今回の患者さんのように精神的にどこか問題のある患者さんに対してどういったアプローチで患者さんに説明なりお話をすればいいのか分からなくて、練習の中でも最終的に何を言ったらいいか分からなくなって、患者さん本人と患者さんの家族の間をずっとぐるぐる行き来してしまうといったような状態になってしまいました。なので今回の練習では英語で何かを説明できる力だけじゃなくて、アンキザイティや不安感のある患者さんに対して英語で安心感を与えれるようになることもすごく大切だと痛感しました。なので自分含め皆さんも今言ったポイントを今後の医学英語の勉強の役に立っていただければなと思っています。それでは皆さん動画の方よろしくお願いします。
I'm
Who are you?
Yuki. I'm Yuki, one of the doctors here.
Doctor, where am
So,
I? Sorry, I don't know where am I.
okay, so it's fine. So, just for confirmation, can I start with the full name and age, please?
Why will I give it to you? I don't know who you are.
Okay, so, sorry, now you are in the hospital ward and emergency department, and according to the report, you are found on the street by some people, and then you have been brought here.
I can't remember anything. Yeah. Okay. So where am I again?
So in the hospital, especially in the department of emergency ward, emergency.
Okay.
Okay.
Okay. Sorry,
Yeah,
I'm
wait.
just still confused and I'm still feeling
okay.
dizzy and having headaches at the moment.
So So just for confirmation, can I have your full name and age, please?
Okay. My name is Kenji
Kenji. Okay.
Nama. Okay. My age, I'm 35 years old.
Sure, 25 years old. So you said you do not remember anything.
No,
But how are you feeling now? Do you have any feeling nausea or anything uncomfortable?
I'm just feeling dizzy at the moment. I had loads of beer in the pub earlier,
Mm-hmm.
and after that I just got dizzy, and then I just woke up and I'm here in the hospital. I don't even recognize this as the hospital, you know. And yeah,
So you said you felt dizziness. Is that going on still?
right now I'm not really, but yeah, I still don't I still don't know where am I right now. Sorry, I'm still confused, you know.
Okay, so again, you are in the hospital, and then we are here to, help you. So you don't have to be scared.
I don't want to be helped, to be honest, but I just want to go home now.
Mhm.
You know, after losing my job, I feel
Yes.
like I don't have anything to do. I just want to stay home and drink.
Oh, that must be, tough, especially when you lost job. Okay.
Hi, Dr. I'm a Kenji's sister. I don't know what happened.
Why are you here? I don't need you.
What have you, the police called me? What's wrong with you? You were just a crop on the street.
Yeah. Okay. So hi. You said you're Kenji's sister.
Yes. I don't know what's happened with him.
So okay. First, let me introduce myself. I'm one of the doctors here,
Okay.
and according to report, he was found on the street, and he has been brought into department, in the department of emergency here.
Okay.
And then right now we are examining what is going on, and then what is, how he's getting on.
Mm-hmm.
And then but it seems, he is kind of he's confused, since he cannot remember where he is now.
Oh my God, Kenji, how much you drinking again? I told you do not drink not really much.
It's just a pint of cider.
I don't believe you. I'm sorry, I don't believe you.
Alright, alright.
He is drinking quite a lot. Normally it is 2 to 3 bottles of wine each day and 1.5 liters of ciders.
Oh,
He's really
that's weird.
alcoholic, really.
So he said he lost, he lost his job, and then since that time he has been drinking quite a lot.
Yes.
Okay, so have you noticed anything unusual in him?
Well, he just really verbally aggressive, sometimes physically after drinking. And
Yes.
he doesn't want to looking for any kind of new job either.
Mm-hmm.
My GP said he got depression. I'm not sure that he's taking depression.
Okay, so since he found out he has got a depression, did he go to his GP or any hospital?
I don't know because he's not listened to me. And I'm living with him. Did you go to GP, Kenji?
Why would I go to GP? I don't need them.
I told you that you have a depression. You're alcoholic. You know that.
I don't have those. I don't believe in those.
Yes, you are. You know crabs on the street.
It's just my daily life. So, I
Oh my God.
my life is worthless. I don't even have a job. I got my divorce. What's happening with my life? I don't even know what's going on.
It's really tough. Yeah, I'm really sorry for that.
I don't know what can I do for him. No idea.
Yeah. Okay. So, I think there are several things we have to discuss. So I would like to do one by one. And so, first of all, for Kenji, you said you just you wanna leave the hospital and go back to the house and still drink.
Yes.
So is that how you're feeling now?
Yes.
Okay. So, but what do you think about dizziness or like other nausea? When you drank a lot.
I only get that when after drinking, usually after a night of drinking, I would
Mm-hmm.
have nausea and vomiting. Or I would
So
be sick and I would be throwing up.
so
And
you
then
do not care about it just so much.
no,
Okay. And then so do you do you know anything about alcohol? Like,
No, I don't have anything.
Are you really sure, Kenji? Are you not taking any drug?
I'm not taking any drugs for sure.
okay. So do you know alcohols, are linked to other diseases like cirrhosis or heart attack as well? Do you know this?
Well, I know this from way back then when I still not drinking a lot.
So what do you think about these diseases in case you're having after drinking a lot?
No, don't think of this because again, I just want to forget about my problems.
Okay. So how, about, other help besides alcohol, like, doctors for depression or other kind of community help? Have you ever thought of it?
I went to the GP. They said that I should get in touch with the mental health team, but I don't want to, so I didn't go there or I didn't get in touch with them.
Why didn't you want to?
It's just because I don't think I need help. I just need to find some things to do, like drinking.
Okay. So can I talk to sister now then?
Yes.
So what do you think about him?
I'm sure he not controlled for any depressions. I was just about for any liver disease or heart disease because I saw the GP mention about it. I noticed that sometimes his skin is a little bit yellowish on the mouth.
So
tired, so easily tired. That's why he can't find a job. That's my understanding.
Yeah. The thing is, because many things, I think he's quite diffusive to other treatment. I think now, just he's thinking about alcohol for his comfort.
He doesn't listen to me at all. I can't.
Yeah.
Him.
And
Can he going to see any psychologist?
oh, he did, but like he said he didn't want help. He didn't need help. That's why. That's how he thought.
But your doctors, he just helping him do something.
Yeah.
Whatever, he's fine. I can't do nothing to do. I can't. He's not listening to me. And he sometimes told me as well when you told him he was drunk.
So okay, so Kenji, hi. So you said you didn't need any help because you don't know what to do. You lost, you got through quite a lot. I know that's very depressive. I also, alcohol is, you can feel alcohol is the only thing you can turn to.
Yes.
Yeah, and then, but still, I suggest you, there are many things we can try besides alcohol, without any risk. Because alcohol, are usually a little bit risky if you drink too much.
I know that.
Yeah. And then, so I know you have a lot in the past, but still we can help you and psychological, physically, because we are hospitals, and then we not only me but also other professions who are expert of many things, and whatever you need you can ask us. And then I know like still you are a bit suspicious or you don't need it.
Okay. So what do we need to do now, doctor?
So I think first and foremost, we have to make sure you are okay at this present, especially after dizziness. Meaning, we do some blood test to check your vital signs and how you're getting on. And then if any abnormality there, we can handle it properly and quickly.
Okay.
Also, you won't, you will not have to stay at the hospital for a long time, but just a bit. So, and then, this is, we are going to do just, immediately. But so I'd next talk about the most important thing. And then this is, requires your help to make our treatment successful. So, you've already said, alcohol is only one thing you need, and especially after a lot of things. So, have you ever felt you need to cut down on alcohol intake?
Yeah, sometimes I think about that, but
Yes.
every day I'll just think about having to drink again because it saves my day from being so down.
Okay, so then, what do you think about, if you have, other support, like, professional support, as well as, support makes you feel you are not alone. You can you can tackle these issues with a lot of, people who have similar problems with you.
Okay.
You do not have to, actually, there are a lot of charity or, supports, which is available for you. And for example, Alcoholics Anonymous in the UK, this is just one group, but they provide you a wide range of support.
Yeah.
And whatever you need, they can adjust, those support, like something tailor-made for you.
Okay.
And then also, as for depression, that depression might be caused alcohol intake. So when you solve that alcohol problem, that depression also can improve. Okay, so far, what do you think about what I said so far?
I will consent on the treatment plan you propose.
And then do you have any concern or another fear?
I'm just concerned that when I get home, no one can help me, and that I have to go to hospital before everyone can help me.
I see. So there are several things we can also do certainly. So you do not have to worry about. First and foremost, even after leaving the hospital, that group which I mentioned is kind of outside of the hospital, so you can access there, when you need. And then also there are other type of support, like some people visit your house and then check you, how you're getting on. This is also available for you. And then and then also most importantly, your sister, can be the biggest support.
Okay.
About the program, we also have and talk about it with your sister.
Okay.
Is it fine?
Yeah.
So just shall we stop now? So it's got a really difficult case today. It's got to be challenged. Okay?
Yeah, super challenge. Yeah, honestly, the most challenging topic.
I think it's really difficult and psychiatric patients. Okay.
Yes.
But be honest with you, this is a very common case in England. Okay.
Yeah.
Depressions, alcohol issues, and drug issues. Okay? If you just work in any rotation, A&E, or even the ward, if you don't more stroke patients,
Yeah.
okay, it's just based on for some alcohols or any other disease. You have a lot of depression. It could be happen. Now, it just need to be, so how you feel about number one?
To be honest, on the way, I was totally lost how to, deal with, the patient who are refusing to, anything else, just, saying, alcohol, because
it's not like a Japanese patient. Japanese patients quite easy to, whatever doctor said, we accept. Some say no, but it's gonna be, it does gonna be more culture differences. Some patients say
yes,
no,
kind of.
Okay.
And then also still, I know like the, final choice about treatment is up to individual.
Yeah.
So however much we try to convince or persuade them, we cannot force, them to do so. So, what the most challenging thing is, not making forceful, but convincing, persuading patients to do, treatments. So I was really struggling in how to do it.
Now, so just to get the feedback from Kenji.
Ooh.
Oh.
Anything, please.
I think you introduced yourself in start of the role play. You've already you started by introducing yourself, which is good. I would also suggest, like, if you see the patient sometimes you can see them starting being confused already. So immediately ask them the 3 questions for checking the orientation. Because you just said that you are in a hospital, you were brought here, the reason why you're brought. You can also tell them the date. Today is the 22nd of November 2020. It's already 4 in the morning. So at least orient them with the time and date as well. Because sometimes they can think that it's still the morning because they got confused. I feel like, oh, today's my birthday, so I can just celebrate, something like that. So just orient them with the time, date, and place. Those are the important thing in reorienting the patient. I think with the tasks, you provided the, what's that? Because I have to ask okay, tell me what's the plan, doctor? Because I understand you should give the psychological support, but it's like you're running around circle. So once you have already talked to the sister and then you went back to me and asked the same question again. So instead you can start there, gaining the consent of patient.
Okay.
Yeah, so gain their consent. So tell them, I will need to perform some examination, like taking your vital signs, take your bloods.
What if the patient would say no at the moment?
At the moment, and then you can just explain to them, okay, the reason why we need this is because sometimes for us we would just say normally in an acute setting you will just say, okay, I need to take your vital signs and bloods. Is that okay? So we tend to forget to explain why we need that. So explain to the patient that it's the reason why you need to take this, and that make sure you use we can use easily understandable words, not saying, for example, oh, I need to take your vital signs. If I'm confused right now, I wouldn't know what is vital signs. So usually just saying blood pressure is okay for them. I'll just need to take your blood pressure. your heart rate and all that. You can say it's for a baseline data, and your bloods will be needed to monitor your liver function. We'll see how your liver is going. We need to check your blood counts because of we'll see if you are healthy enough to be sent home, all that. But yeah, and then you need to explain your treatment plan for him. You provided the community support. You can tell as well all the referrals that you will be making, and then like in the end you can just do a summary of what you have discussed, like okay, so just to let you know, this is what we have discussed. We will need to take some of assessments here in the hospital. We'll give you medications as needed to control the alcohol in your system, and then we're gonna refer you to this.
Yes.
Then yeah, and then always acknowledge this. Well, the sister is there, so you acknowledge the presence of sister, which is good.
Okay. So it's really difficult. The Kenji already give you feedback, okay? So it is sometimes you already know the story for the patient. He had lost a job and he had a divorce. Okay? So the reason why it could be that the trigger for the Kenji becoming this pushing back or wrong way. So now you have to need to be, again, the same as other situations, any case scenario, you have to need to sympathize what's to happen. It's sometimes they said, I'm sorry to hear that in the clinic. So because he already mentioned, or sister said, yes, because Kenji started in this situation because he had a divorce and he lost a job. And it just sometimes you have to need to show, you have to need to your sympathy to the patient. Oh, Kenji, sorry about that has happened, the situation, but I'm helping you. But I just need, of course, need how. There's some depression patients, of course, we're going to refer to psychiatry department and just need to be counseling. But sometimes the doctors need the counseling skills. It's very important, even nurses as well. Sometimes this patient type in the clinic or in the ward, when they do the ward runs or to talk to the patient, it sometimes takes time. The normally ward runs 10-15 minutes. It's going to be quick shot.
Yeah.
But sometimes it's going to be okay. I'm going to sit down for the separate rooms and with the sisters and discuss about your future. So something like that. Okay. So you just need to think about a little bit more how psychological support these patients, or any, for example, in the UK, how did you support for any depression or alcohol abuse patients? So just need a little bit more top up. The treatment plan explained to Kenji and sister. Is some patients didn't bring it, can't find any next of kin. Okay, it's like a homeless. That's more challenge.
A lot of homeless.
You'll be fine, Kenji. Okay.
Yeah. Thank you for all the feedback. It was very helpful.
Yeah. Okay.